How do we define vulnerable populations in bioethics? Imagine a group of people who might not be able to speak up for themselves or make decisions easily. These are the individuals we call vulnerable populations in bioethics. They are groups or people who have a harder time protecting their own interests. This can happen because of age, health issues, social status, or other factors. For example, children, pregnant women, prisoners, the elderly, or people with mental disabilities are often considered vulnerable. Sometimes, economic or educational disadvantages, ethnic minorities, or refugees also fall into this category. Their vulnerability comes from limitations in their ability to give clear, voluntary, and informed consent. This means they might not fully understand or be able to decide about medical treatments or research participation. Situational factors like poverty or social marginalization can increase their risks of harm or exploitation. In bioethics, the principle of justice is very important. Justice asks us to treat everyone fairly and prevent unfair burdens or exploitation. Protecting vulnerable populations means making sure they are not unfairly excluded from healthcare benefits or research opportunities. It also means they should not be exposed to more risks than others. To do this, researchers and healthcare providers need to carefully assess risks and benefits for these groups. They should adapt consent processes to match their capacities, like involving authorized representatives or family members when needed. Additional safeguards are often necessary, such as extra privacy protections or oversight by ethics committees. Practically, this means designing studies that respect the autonomy of vulnerable people. Researchers must be extra cautious about privacy, confidentiality, and avoiding coercion. For example, they should ensure that participation is voluntary and free from pressure, especially when hierarchical relationships exist, like between doctors and patients. When working with vulnerable groups, it is essential to balance the potential benefits of research or treatment with the possible risks. This way, we uphold the core ethical principles of respect for persons, beneficence, and justice. In summary, vulnerable populations are groups or individuals who face increased risks of harm or exploitation because of factors that limit their decision-making or protectiveness. The core ethical principle of justice guides us to provide extra protections, ensure fair treatment, and carefully weigh risks and benefits. This helps create a healthcare and research environment that is fair, respectful, and safe for everyone, especially those most at risk.